something that people don't know a lot about, and that's fibromyalgia.
Yes, fibromyalgia. It is a chronic problem. It's a chronic condition that causes widespread body pain and extreme fatigue. And although it is common, there's very little that's understood about it, and as a result of that, what happens is what is a complex condition is even harder to deal with for those that have it. So what the underlying mechanism is that we think it's related to a change in the way that the brain and the spinal cord process pain. So people with fibromyalgia tend to have abnormally high levels of the certain chemicals that signal pain, so they tend to be very sensitive to pain. Now, it can run in families, it's common in women, but it can often develop after some form of trauma, which could be things like a fall, an accident, surgery, childbirth, and even viral illnesses.
Yeah, and it's called, apparently, the imaginary condition. So many people, as you said yourself, do suffer from it, but it's not really spoken about. My mom has it, and she's been dealing with it for years.
Yeah, and it's an awful label to put because it is a very real condition. I think that one of the reasons is that because of the lack of understanding over the decades, people that are living with fibromyalgia, they're often stigmatized. Their symptoms aren't taken seriously, or they're often disregarded, which makes it very hard to live with. And some of the reasons for that is that there is an exact test for it, so it's often a diagnosis of exclusion. So you take the symptoms, you usually find not much in the blood tests and investigations, and therefore we arrive at this diagnosis. Now, I see this day in and day out in my surgery, so I see how patients really struggle. Closer to home, my mum has suffered from it for over 20 years. And I remember being at medical school, and it wasn't something that was talked about or taught even. I remember clinicians in those early days really disregarding the symptoms and saying, well, there's nothing wrong with you. But we watched her really struggle with pain and exhaustion. And we need more research, we need more awareness, we need more treatment options, because we know that if you have fibromyalgia, the studies show that you are at a higher risk of things like infections, of severe mental health problems, of accidents. And I think generally what we do need for everyone is to be more compassionate and supportive to those that are living with this condition.
Absolutely.
Like we know people are suffering, we know there's no cure.
This is me, every second, every minute, every hour, every day. This is what I have to live with. Doctors are arrogant and I look normal, but I'm not. It's awful to live with this. I hate it. Every time I go out and I park in a disabled spot, because I am registered disabled, I get looks because I look normal. If you could really live a day in my shoes, you would wish it was gone. I just wish that there was more awareness and people spoke about it. So hopefully this is a step in the right direction for people to understand this awful condition. And people are more aware. I struggle every day and it's awful, really awful. And I ain't done any lives because I've just been so poorly, so in pain. The weather affects me, slightest little change, stress. So I would advise for people to Google and research this condition to have a more understanding of it.